The outbreak of meningitis has left 21 people dead, 270 more sick in some 16 states. Now, questions about the role of Medicare. Officials in the giant health insurance program for seniors want to know how many beneficiaries were among those affected. The illnesses linked to an injectable steroid used to treat back pain, coming from a specialty pharmacy in Massachusetts. It is those compounding pharmacies that have some watchdogs worried.
When you have a compounding pharmacy acting like a drug company without all the protections that the regulations are intended to implement, we can have large-scale harm to the population at large.
The government has rules.
Medicare has a standard for covering a drug, and that standard is the drug has to be reasonable and necessary.
And its policy?
It appears to clearly state that, as a general rule, compounded drugs do not meet that standard.
So what about enforcement?
There are all sorts of overlapping authorities. The compounding pharmacies are primarily regulated by the states, says FDA. But, you hear some people saying, well, FDA still has a lot of power.
But compounded drugs continue to be produced for the mass market, with apparently little oversight from the federal government, and not much of a push from Medicare to use its own power to deny payment. Lee Powell, The Associated Press.